What's that sound? From sitcoms to movie depictions, the chiropractic profession has certainly earned its Good Sport Award as we've watched actors enact what they believe to be a recreation of a chiropractic adjustment accompanied by a very loud series of noise sound effects. In reality, though, one of the most commonly asked questions in a chiropractic office is, what is that sound? Patients are often inquisitive about the popping and cracking sounds and different types of chiropractic adjustments that can be utilized. Many patients have visualized that chiropractic care is one thing and done only one way. They may expect back-wrenching positions like they see from sitcom stereotypes. They may expect loud noises. They may think that just anyone can provide an adjustment. These notions, however, are far removed from the actual patient experience in a chiropractic office. Doctors of chiropractic, DCs, adjust diarthrodial joints. These are freely movable joints created by two bones surrounded by a joint capsule. The capsule is filled with a lubricant called synovial fluid. Synovial fluid also serves as a source of nutrients for the cells that maintain the joint cartilage. Within its contents, synovial fluid also contains dissolved gases of oxygen, nitrogen, and carbon dioxide. Zygapophyseal joints. Let's say that again. Zygapophyseal joints. They are more simply known as facet joints, and we're talking about them because they are synovial joints that are found between vertebral bones along the length of the spine on both sides, both at the top and the bottom of each vertebral segment. They allow for the variety of bending, arching, and twisting motions that come from our spine. Facet joints are the most common joint type adjusted in the chiropractic office. That is why we're talking about them here. You can see them located in this image at the arrows to the posterior of the vertebra near the spinous processes. The formal term for noise when moving a joint is joint cavitation, not snap, crackle, pop. When a joint capsule is stretched to the point of resistance, it creates pressure within the synovial fluid that causes the exchange of dissolved gases. Recent studies indicate that the process may actually create a cavity within the capsule fluid, allowing this to happen. DCs will often explain this to first-time patients so they are not alarmed. It's important for patients to know that their bones are not literally cracking. Encourage patient questions to help educate them and put them at ease. Patients may ask questions such as, is the sound from the bones grinding together? Is the popping sound causing damage? There was no sound. Did the adjustment happen? Can I safely adjust myself or have a friend do it? As we just described, the sound itself is not bones rubbing together. The sound certainly does not indicate damage, or we wouldn't adjust people. The presence of a noise or lack of it in no way indicates the success or failure of an adjustment. It is normal and expected, should it occur, but in some cases there is no noise at all. And lastly, only a trained provider should attempt the procedures. Despite common lingo about back cracking, chiropractors do not crack the spine. We also are not fond of the word manipulation. It sounds like something unnaturally forced is occurring. Semantics do matter. In our profession, we like to call the procedure an adjustment. A chiropractic adjustment is a safe, controlled force applied to a joint or joints to restore proper function and mobility. Why can't a friend just crack my back? Well, first, it's gross manipulation. Adjustments provided by DCs are very precise corrections that address the way a joint has shifted. Unlike popping your knuckles to simply make a noise, DCs examine and palpate the spine to determine the exact joints involved and the XYZ axis, three-dimensional space, of how they have moved out of alignment. They are then able to issue a gentle, controlled adjustment with a precise line of drive applied to the particular joints that are involved. Having your friends try to crack your back may result in a cavitation noise, but these are not precise and could actually be moving bones in a more misaligned direction and cause harm. Only a trained professional should issue an adjustment. Chiropractic care is not limited to only the spine. DCs also understand the complex anatomy associated with the joints of the extremities, such as the shoulder, elbow, ribs, hand, hips, knees, and feet. They are specifically trained to evaluate and adjust all areas of the human skeleton. As a special side note here, many DCs may also care for the TMJ, or temporomandibular joint in the jaw. It is a very differently structured joint and is the only joint in the body, other than those in the spine, that actually contains a disc. When DCs work on the TMJ, they typically have taken a specialty course to do so, and the treatments focus more on soft tissue work inside the mouth and with the muscles of the head that attach nearby. The TMJ is a diarthrodial joint between two bones, the temporal bone and the mandible, but it is also uniquely classified as a gangliomo-arthrodial joint because it allows for both hinge-like and sliding movements, which is very unlike most synovial joints. This, along with its unique movable disc, which divides the joint into two separate cavities, enable us to engage in the complex joint movements that we need for eating. The TMJ cartilage is made from tough fibrocartilage versus hyaline cartilage, which is much more resilient to the daily wear and tear that we need in the face and jaw. TMJ pain can be excruciating. Chiropractic care for those with TMJ issues can provide immense relief from that pain and aid the joint tracking issues for many patients that suffer with it. To accomplish the goal of adjusting the joints of the human skeleton, there are a wide variety of effective techniques that DCs learn about and implement. These include popular hands-on techniques like diversified or Gonstead, or may utilize special tables with pieces that drop away, like flexion distraction or Thompson, or may use instruments held in the hand like activator, just to name a few. Though joint cavitation may often occur, different types of adjustments may have different levels of it. Many methods will not have any noise at all, but they are equally as effective in correcting joint alignment. There are many named techniques out there, and the DC will pick one or a combination that they feel is best suited to a patient's individual needs or preferences. A broad overview and explanation of what you might experience are given in the next few slides. Hands-on techniques. With hands-on techniques, it's exactly as it sounds. The DC uses their hands on the patient's body to issue the adjustment. There are a variety of techniques that go by different names to delineate different hands-on manual adjustment methodologies. With some of them, you may lay on a table, face up or face down. With others, you may sit, yet others may use blocks or specialized pieces of equipment designed for the technique. A few examples are listed on this slide, but there are many named techniques out there. Diversified is certainly one of the most popular. Gonstead, Thompson or Thompson drop actually uses a drop table, flexion distraction, and Nuka and toggle are a couple of techniques associated just with the upper neck. Your body will be positioned according to what joints are being addressed and which method is being utilized. With some of these techniques, you may be more apt to hear a cavitation noise. However, it is also not unusual for a bone to silently slip into place during the procedure. Special tables and equipment. For certain techniques, special tables may be indicated. Some chiropractic tables will maneuver patients from a standing position and lower them to a position lying face down. These are often called a high-low table. These tables are to maintain the weight-bearing position that a patient had standing and also to make it more convenient for patients that may have trouble maneuvering positions. Some tables may have moving pieces that the DC will use to facilitate the adjustment. These require less body positioning. Patients will hear the sound of the moving pieces during the adjustment and may feel a slight shift in the position of a table piece. One of these is called the Thompson drop table. And flexion distraction tables may have features that move to provide traction and or bend or sway to address specific spinal joints or disc injuries. Other special equipment may involve instruments. Small handheld instruments are used by many DCs, and Activator is one of the most popular and has its own protocol for patient assessment. There are other instruments out there. We are simply using this one as an example. Activator instruments are spring-loaded mechanisms and provide rapid low-force impulses to targeted areas. The goal is to issue rapid impulses in the direction of correction before the muscles have a chance to tense up. The impulses can be calibrated to be extremely light or heavier depending on the patient and region or joint being addressed, and can even be used on many patients with osteoporosis. Instrument adjusting is less likely to result in a cavitation noise, but again, any adjustment may or may not have a noise, and that does not indicate whether or not it was an effective treatment. After adjusting, DCs may motion palpate again or perform other tests to ensure the adjustment was effective. Here I'd like to add another special note that some chiropractors will undergo more schooling in order to be able to adjust animals of every sort. Dogs, cats, and horses are certainly very popular. Now, practicing animal chiropractic may be extremely dependent on what state you're in. This is a state mandated thing. So depending on state laws, that will dictate if DCs can adjust or if you have to be a veterinarian. Animals absolutely love it. I'm educated in adjusting humans, but animals have different spines and biomechanics. So I take my own cats and dogs to a colleague with that extra training. Thank you, Dr. Bob. Chiropractic care is just as beneficial for our animals' health as it is to ours. We actually had a Great Dane puppy way back in the day, the runt of the litter that became part of our family. We noticed it had a back hindquarter that was atrophied and not developing. After chiropractic adjustments, it could walk without issue, and all of its musculature started to develop normally. Animals too may sometimes have a popping noise or may not during an adjustment. I know in our area we have a lot of farm animals that need some help, a lot of pets like cats and dogs, but we asked Dr. Bob what was the absolute strangest animal that you have ever adjusted. And his answer was a large iguana called a bearded dragon, who he said was a very, very good patient. Having specific care is paramount and certainly not performed as comedy like we see on our favorite sitcoms and in movies. A diarthrodial joint provides the ability for movement, but it also limits movement to prevent injury in our body. It isn't difficult to pop a knuckle and stretch a joint capsule to make a noise, but a well-meaning friend trying to pop your spine, like on a sitcom, could actually overstretch the capsule or move joints in the wrong direction and cause way more harm. This is why only trained professionals should ever attempt to practice chiropractic and adjust your spine and extremities. When chiropractic care is implemented by a trained provider like a DC, specific adjusting affords multiple benefits, including the restoration of optimal range of motion, the normalization of local nerve function, or even vascular function for those structures that might be directly impacted, the relaxation of muscles adjacent to the joint as they are able to stop protecting the joint through spasm and resume their natural position, a decrease in inflammation when the stress on the joint capsule is resolved, and a decrease in pain through the release of endorphins at the region of care. As we get joints moving, a chiropractic adjustment is multifold, with or without a noise, and holds the advantage of not only properly optimizing joint function, but also providing patients relief from the many symptoms associated with it. As we wind up this video, I hope you've learned a bit more about chiropractic adjustments, cavitation, and how to provide answers to patient questions.